As Betty said, my name is Marcia. I live in Springville, Maine, and I'm Maine Healthcare Action's field director. What brought me to healthcare, I worked in the industry for 20 years. I was a CRMA, CNA, and then an LPN, and then worked as a DSP with behavioral health and got burned out, got into politics, and here I am now, back in healthcare oriented, but a different end of things to make things better. So that's a bit about my background. To tell you a little bit more about Maine Healthcare Action, we are leading a citizens initiative to put universal healthcare on the ballot in Maine for November of 2022. Our deadline to have everything to our Secretary of State is January 31st. So we're at the final stage of this initiative, this phase of the initiative. And what this does is requires Maine legislature to draft and enact a publicly funded healthcare system in Maine that all Maine residents are included in. We did not write a specific bill for the reason we have a lot of our legislatures have been working with universal healthcare for a while. And we came within a hair this past session of actually passing and implementing a universal healthcare system in Maine, but it was amended so they could vote on bipartisan terms, and it hinges on federal legislation and Ro Khanna's bill passing. So we kept going with the initiative as recommended by our reps that were involved in sponsoring the initial bill, and this will hopefully push them to that next level. It does not say in our resolve that they have to use that, but we know they have that in place. Right now, I mean, obviously our biggest need is people on the ground collecting signatures. It's super hard for people in other states. Actually, we had never thought of it until Catherine had reached out to us and mentioned it, and it kind of blew our minds, and thank you very much. We're still wrapping our heads around that. I mean, you hear about, paid folks coming in and whatnot, but this is a whole different ballgame, and we're touched. Anyhow, we have, like I said, about 7 weeks left to actually gather the signatures. We have 20 to 25,000 left to get. Anybody who does decide that they do want to come to Maine, we'll send you a petition packet, and we'll do trainings, and I'll onboard you like we would anybody new, and we can go over the details later. We are working on helping on lodging for people as well. So that will be something that we will offer, is places to stay, which will be hotel rooms or Airbnbs. We haven't decided which yet, depends on how many people come. Also, we need help remotely. Phone banking will be coming up probably in the near future, and as well as getting more traffic on our social media posts, just liking, sharing, and so forth. And do you want me to share my links now, or would you like me when I come back on?
Why don't you go ahead and share your links now? We have a couple minutes that we could still work on this, and then you can go in after we've asked a few questions. We can have you go into a breakout room, and if anybody came just to hear you tonight, they can go in the breakout room with you, or you can just do multitasking other stuff until about 9 or 9:10 or whatever. Actually, it'll be a little bit later than that, and then we'll have everybody get together to ask the rest of the questions and find out more about the social media if anybody needs help on that after we adjourn the meeting. So I see Lynn took her hand down, so you already answered her question. If you can go ahead and show a little bit of your social media stuff, like your Facebook page, your Twitter account. Whatever.
I can share all that too. Let me scroll down.
Thank you.
I have it all. Our Twitter account is @Maine_Action. This is the link to our Facebook and our Instagram. Like I said with this, all we really need is just people to kind of like the posts. If you want to share it, that's fine. Leave a comment, maybe in support about universal healthcare. It's nothing major. It's just helping those algorithms so more people see it. And the more people that comment and like, the more people that see it.
Great, thank you.
And are you working with Our Revolution or Progressive Democrats? We've reached out to both and have not heard back from either. A lot of the organizations we have found do not want to back us until we are on the ballot. That seems to be
Oh,
the frequent thing. Like I said, our Revolution and Progressive Democrats, we have not heard back from, but there's been other major organizations that we've reached out to, and they said, you make it on the ballot, we will help. So it's a
okay.
catch-22.
Yeah, yeah. Okay, Barbara Harrison, you have your hand up?
Yes. What expectations do you feel like in Colorado, which was not really single payer, that groups are going to come in with a lot of money to undermine your efforts?
It's going to happen. It will. We expect, the bigger hospital systems, obviously, to buck this, and pharmaceuticals, and the insurance companies, of course, are really, I think they're going to be our biggest contender. That's okay. The support that's been out there in Maine has been absolutely incredible. One of the recent polls that one of our papers did for us, it was over 63% of people that supported, and we're seeing the same things when we're out there collecting signatures. So we will have opposition, but there's a lot of support there, and we already kind of know what they're going to come at us with, which helps. And interestingly enough, we had a couple of right-wing media reach out to us, and I gave some quotes and wondered how it would go, and I was impressed. We weren't ripped apart. It was very factual. And so, yes.
These were local Maine media outlets?
Yes, and but they're conservative ones.
Yeah. Okay.
And it was good.
Excellent. That's excellent.
So you're ready then.
Oh, yes.
And you've anticipated the behavior,
Yes.
so you're ready to fight back, so to speak.
Yeah, hi, thank you. I was just very briefly looking at your website, and I was wondering, I didn't see any specifics about, are you pushing for a global budget and pay for fee services, or what is your, I mean, I didn't see any of that detailing in the legislation.
That's why it's a resolve that we're doing. So there's no fiscal piece in there. That will be up to our legislature.
Okay.
Yeah, there's a whole reason why we did that. Our legislature also has kind of been famous in the past for taking something, initiative that the people pass and pulling it apart. And then we don't end up with what people voted on. In this case, they're just voting, saying, we want you to enact a publicly funded system that covers all Maine residents. And it has to be done by 2024. So it takes a lot of that power on that end that they have. But on the other hand, we have a lot of representatives that support doing it. So there was a lot of pieces involved in this decision. But no, there is not, long story short, there is not a fiscal piece on our initiative.
So I see that you posted the language petition. Can you also post the bill, the legislative bill, and you may send that in an email later if you don't have it right off the bat, but the language, what was, the link for the bill that has already been passed, that would be super.
I can do that. Yes, I can email that out.
Great, thank you. And Lynn Heidecker?
You're welcome.
Well, you pretty much answered it, but because I was going to say, what is the ask in the petition?
It's
is there any mandate in it that they need to respond
by 2024? Yeah, they do have to do this by 2024. There is a mandate. It is legally binding. It's like any other initiative that we'd have here in Maine. It just, like I said, it opens up the legislature to do, write the legislation.
Great, thank you. Any other question? Consuelo?
In that, are you following any of the previous attempts for universal health care? I don't know if you know what's happening here in Washington State, but we are in a pretty exciting position with our universal. So have you looked at the WISC or at other frameworks as models to follow?
We not super closely. A lot of us worked on ranked choice voting beforehand, and made that happen in Maine. So we already kind of had a framework as far as an initiative going, but I've watched, Volatile Washington in Washington for a little bit. Actually, even before the healthcare thing and what goes on in Washington, because you guys mirror what we do a lot. So my eyes are on you guys, but yes, I've watched Whole Washington and the different actions that have been done and follow the Twitter and the Facebook and whatnot.
Great, thank you.